Veteran Affairs to prioritize minority veterans during initial rollout of the COVID-19 vaccine. Wow. This is how it's going down. The Department of Veteran Affairs will prioritize Black, Hispanic, and Native American veterans receiving COVID-19 vaccines. We're considering the disproportionate impact of COVID-19 on racial and ethnic minority groups as we plan for how to offer COVID-19 vaccines to veterans, the VA said in a document released last week. Black veterans have been disproportionately affected by COVID-19, accounting for 16% of cases and 22% of deaths in the VA system, while only accounting for 12% of the veteran population in the country, according to Stars and Stripes. White veterans account for 60% of the cases and 61% of the deaths, while comprising 77% of the veteran population. In addition to offering the vaccine minority veterans first, the VA will also prioritize those at greater risk of spreading the virus or at risk of becoming severely ill from it, as well as patients at higher risk, such as elderly veterans or those with pre-existing health issues. The VA said that the phased rollout is a result of the department having a limited amount of vaccine shortly after its FDA approval. The agency also indicated it will be offering the vaccine to its frontline staff, who make up the largest healthcare system in the country at over 350,000 workers. The agency submitted its plan to the Centers for Disease Control and Prevention in October and said it is working with the CDC on administering the doses. We're working with the CDC and other federal partners to develop a phased plan that will help us to do the most good for the most people, the VA documented. The VA said that as more doses of the vaccine become available, all 9 million veterans enrolled in the VA healthcare will be eligible to receive it free of charge with no co-payment. It will only be available to VA medical centers, not the community-based outpatient clinics. VA will be releasing its nationwide vaccine distribution plan soon. VA Press Secretary Christina Knoll said, under this plan, veterans and VA employees who indicate a desire to be vaccinated will receive a vaccine once it is authorized and available following the prioritization guidance from the CDC and the VA. The VA did not immediately respond to a Washington Examiner request for comment. The Food and Drug Administration on Friday approved emergency use authorization for the Pfizer-BioNTech COVID-19 vaccine. The U.S. government agreed to purchase 100 million doses of the vaccine, some of which are already being distributed across the country. Make no mistake, distribution has begun, said General Gustav Perna, the chief operating officer for the Defense Department's Operation Warp Speed. Right now, boxes are being packed and loaded with vaccine with emphasis on quality control. Wow. So the veterans are going to be getting it. That's the thing. And this vaccine has been known to cause Bell palsy, which is basically half your face will be paralyzed for a temporary amount of time. Okay. There have been other instances where it has killed people, this vaccine. So I don't know what to say, man, but this is what you all got to look forward to. All right. If you like the content, like, share, comment, and subscribe. And definitely share. Later.